Hello, my name is Claire and I'm the founder of Student RDH Dental Hygiene Boards Review. We offer national and local anesthesia review courses through our online website www.studentrdh.com. Today, let's see how we can maximize our scores on any exam, especially the board exams if you are going to take them, because there's always ways to improve. Until we submit our answers, the deal is not closed. There are some things that we can do. And there are 4 things I would like to talk about. They are: find a keyword, pretend you're reading a text in a new language you just learned, play a true-false game where you are seeing a question that is asking the exception. Before submitting your answer, use the rewind strategy to review it. And today we are only going to talk about tip number 1. So this article I wrote for Dentistry IQ recently. It got very good responses, probably because there was something that student wanted to learn about more and also talk about this when I visit schools through some meetings and if I do lunch and learn. But I also wanted to share it with everybody else who can watch this YouTube channel. So first, tip number 1, find a keyword at all costs. No matter what happens, you have to find the keywords. So this is a show that I love, How to Get Away with Murder. I don't really have time to watch it anymore, but I think it's a great show. But anyways, that's not the point. The point is, they're detectives, they're lawyers. What are they looking for? They're looking for clues. Something that is going to take them to their final answer, to the final solution, to the final conclusion. We have to do the same when we take our exams, whether it's a school exam or it's a national board, it's a big exam. Every question is built with some keywords in there. But those keywords do not have to be anything that's like difficult, like this. Okay, it can be something that's so simple as knot, pink, swollen. Anything you can think of can be a keyword. Why are we doing this? By choosing keywords, we are now able to just delete the background noise, because not every word in the questions are important. Usually there are 1 to 5 keywords in each question. The strategy is really simple. Find those 1 to 5 keywords in each question, even if you have to read the question again and again. It's a much better idea to spend time on finding those keywords than just to read it once and moving on. Because at the end, students don't use their entire time to finish the exam, so usually you have time left. So why not slow down a little bit and really focus on those keywords? Because also, they give you some words that are going to be tricks. So if we didn't pay attention, if we didn't try so hard to find what's really important, we might be tricked over those words that they have given us on purpose. Let's look at an example like we always do. The texture of the tissue affected by chronic periodontitis is mostly likely to be. So it's asking, when you have chronic periodontitis, what the tissue would be like. And here, what would be the keyword? Among all of those, I think this is the keyword, chronic, because there's a distinction between chronic and acute periodontitis. Chronic has been going on for a long time, and acute is something that's just short. And the answer here, answer choices: smooth, red, fibrotic, shiny. So if we had our keyword that is chronic, our answer would be fibrotic. Because with acute periodontitis, there's like inflammation. The gums are shiny, swollen, and red. With chronic periodontitis, there's more scar tissue that's formed because the disease has been there for a long time. So the scar tissue makes the gums look a little more fibrotic, and it's going to look tough. It's going to be a little more pale than red and shiny. I hope this helped. Let's just look at actually one more example that's coming directly from Student RDH website. Here you can see this is related to oral pathology. The one we just saw was periodontology. Let's look at this question. Your patient of the day, 23 years old, 7 months pregnant. That could be a keyword as well. Used to smoke. That could be a keyword. Frequent tanning salons. Okay, that's a keyword also. Let's see, let's continue. On several gingival papillae, you notice deep red purple exophytic lesions measuring several millimeters. And the question is asking you what this lesion is most likely to be. Here, this is an example of how many things that can trick you. Here, 23 years old, pregnant, smoking, tanning salons, deep red purple lesion, several millimeters. There's a lot of things going on, but the most important thing were here, deep red purple lesions and pregnant. This would give us the answer that would be PG, that is also sometimes called pregnancy tumor. And let's check the answer. This is correct. So here the trick was that if you were tricked over smoking, then you might have chosen smoker's melanosis, which is completely not deep red purple, and it's not related to pregnancy either. So that could have been a trick. Also, tanning salons, it's another trick. Then you would have maybe thought solar cheilitis. Solar cheilitis would have the appearance of pale lips or pale border of the lip to the facial skin. So this is just again an example of how when there are a lot of different things that you think are keywords, you should just focus one more time and try to find the real clues. Alright, and this is it for today. We are going to continue with tip number 2 to 4 on our following videos. And please visit our website, studentrdh.com, and you can always do the free trial, read our blogs, and sign up for local anesthesia or the national boards. Thank you. Get up!